Ladies and gentlemen, please join me in giving a round of applause to His Excellency the Vice President of the Republic of Indonesia.
Let me first of all convey the greetings of the Secretary General of OIC, His Excellency Professor Ibrahim Esanu, who despite his best efforts could not make it, but he had to travel to another very important mission. He has sent his best wishes for the success of this conference, and inshallah, as the proceedings have started since yesterday, we are going to wonderful. It's an honor for me to address this inaugural session hosted by the Honorable Vice President of the Republic of Indonesia. This kind gesture is reflective of the significance attached to the OIC by the government and the people of Indonesia. As a country with the largest Muslim population and a founding member of the OIC, Indonesia has contributed significantly to the work of the OIC and in furthering Muslim causes around the world. I take this opportunity to thank the government of Indonesia for making excellent arrangements for the fourth session of the Islamic Conference of Health Ministers and a warm hospitality extended to us. We are also extremely grateful to the Honorable Vice President for chairing this meeting. The adoption of the 10-year program of action, the OIC has steadily expanded the scope of its activities in the domain of health. Our efforts that resulted in many positive outcomes, and the OIC is now acknowledged as an important partner and an actor in the health field. Excellencies, ladies and gentlemen, the three previous Islamic conferences of health ministers had made concrete recommendations for addressing a large number of health issues relevant to the OIC member states and the international community at large. This morning, we also took important decisions regarding promotion of self-reliance in production of pharmaceuticals and vaccines. And we are confident that under the able stewardship of Indonesia for the next 2 years, the OIC member states, OIC institutions will be able to move collectively towards attaining the objectives of the strategic health plan and raising the health standards and health equity across the member states. I thank you very much.
On behalf of the delegations represented in this fourth session of the Islamic Conference of Health Ministers, let me extend to Your Excellency, Mr. Vice President, our heartfelt thanks for your kind hospitality receiving us at this inaugural session of this conference. I am proud to say that this auspicious occasion in the Vice Presidential Palace reflects the strong commitment of the Indonesian government. Excellency, Mr. Vice President, your personal attention to this meeting elevates the significance of our deliberations and reminds us that this gathering is not just one more technical meeting. The Islamic Conference, Mr. Vice President, the Islamic Conference of Health Ministers was established in 2007. This year's conference marks the fourth time the health ministers of OIC member states or their representatives have gathered to review the implementation of our commitments and the outcomes of previous Islamic conferences of health ministers. This year, the ICHM, Islamic Conferences of Health Ministers, is attended by 39 OIC member states. 14 of those countries are represented at the level of ministers. This conference is also attended by representatives from international organizations and invited guests. Preceded by the meeting of the Steering Committee on 21st October 2013, our three-day meeting will strengthen participants' technical knowledge related to various important health issues within the OIC community. We will also produce important decisions intended to continue our efforts in improving the health status of the Ummah of OIC community of nations. Excellency, Mr. Vice President, ladies and gentlemen, guided by the theme Better Nutrition, Better Health, Better Ummah, the conference will highlight the important contribution of good nutrition in preventing high-risk pregnancy and enhancing healthy child development, which serves as the foundation for development of self-reliant and productive societies. There are challenges in implementation of maternal and child health programs, as well as communicable and non-communicable diseases. With regard to the issue of maternal and child health, we find that in some of the OIC member states, child mortality rate and maternal mortality ratio tend to remain higher than the Millennium Development Goals. Another major problem in many developing countries, including OIC countries, is the high mortality and morbidity among women during their reproductive years as a result of unrecognized or unmet needs associated with pregnancy and childbirth. According to WHO in 2010, at least 287,000 women in the world died from complications related to pregnancy or childbirth. In addressing these challenges, OIC will not only improve the situation in our own people, but will contribute to global efforts to reduce child mortality, improve maternal health, and address communicable and non-communicable disease problems. For all these reasons, our discussions over the next 3 days are important for all of us as responsible global citizens. As part of our strategy in addressing and resolving challenges in the field of health, the OIC member states have taken the initiative to develop the Organization of Islamic Coorperation Strategic Health Program of Action 2014-2023 to guide our health cooperation and promote positive synergy among our respective efforts. The OIC Strategic Health Program of Action will guide OIC member states on how our health cooperation will contribute to the achievement of the highest health status of the Ummah by improving community access towards comprehensive and quality health services. It is our ambition to see adoption of this OIC Strategic Health Program of Action for the period 2014-2023 in the 4th session of the Islamic Conference of Health Ministers. Actually, Your Excellency, it has been adopted this morning. Mr. Vice President, we also look forward to the adoption of the Jakarta Declaration on Health and OIC resolutions on issues of common concern in this meeting. The Jakarta Declaration on Health highlights various issues, among others, with regard to MPTs, international health regulations, universal health coverage, communicable and non-communicable disease control, and, of course, nutrition. The conference is expected to adopt resolutions relating to these issues. Excellency, Mr. Vice President, in this conference, Indonesia has assumed the chairmanship of the Islamic Conference of Health Ministers for a 2-year period, 2013-2015. With the trust provided to Indonesia and under your patronage, Mr. Vice President, I would hereby reaffirm Indonesia's commitment to do our best to lead this great cooperative effort in the field of health for the benefit of the OIC member states and their Ummah. In closing, I renew the great appreciation of the delegations of the conference to you, Mr. Vice President, for having graced this inaugural session. We look forward to your wisdom and guidance as we are conducting our conference. Yang terhormat Bapak Wakil Presiden, dengan hormat kami mohon kesediaan Bapak Wakil Presiden untuk memberikan arahan serta membuka secara resmi konferensi Menteri-Menteri Kesehatan negara-negara Islam yang keempat. Terima kasih. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Pengalaman sejarah bangsa-bangsa juga menunjukkan bahwa meningkatkan derajat kesehatan dan tingkat pendidikan umat secara merata dan berkesinambungan bukan pekerjaan mudah. Apalagi bagi negara-negara yang masih pada tahap awal pembangunannya. Di bidang kesehatan, peliknya dan besarnya masalah yang dihadapi di negara-negara ini menuntut inisiatif, dedikasi, dan kerja keras dari mereka yang bertanggung jawab di bidang itu, mulai dari Menteri Kesehatan sampai ke pelaksana di lapangan. Namun kita juga menyadari bahwa ternyata banyak pula masalah-masalah yang erat terkait dengan kesehatan, tapi berada di luar bidang kesehatan atau di luar kemampuan Menteri Kesehatan untuk sendiri mengatasinya. Misalnya saja masalah keterisolasian komunitas sasaran, masalah kekurangan dana, masalah kelemahan birokrasi pelaksanaan program, masalah budaya yang tidak menunjang, masalah keamanan, dan bahkan masalah politik yang lebih mendasar. Banyak anggota OKI yang belum berhasil mencapai 3 tujuan utama MDGs yang terkait dengan bidang kesehatan. Ketiga tujuan itu adalah tujuan yang keempat, menurunkan angka kematian anak. Tujuan yang kelima, meningkatkan kesehatan ibu, dan tujuan yang keenam, memerangi HIV/AIDS, malaria, dan penyakit menular lainnya. Bahkan di sementara negara, indikator-indikator bagi ketiga tujuan itu akhir-akhir ini justru menunjukkan tren yang menurun. Tantangan ini harus dijawab oleh para Menteri Kesehatan UKI dan oleh kita semua. Saya sangat menyambut baik langkah ini. Hadirin sekalian, sebelum saya mengakhiri sambutan saya ini, perkenankan saya menyampaikan laporan kepada para peserta konferensi bahwa pada bulan Januari tahun depan, Indonesia akan meluncurkan program di bidang kesehatan yang sudah cukup lama kami persiapkan, yaitu program Jaminan Kesehatan Nasional, suatu skim asuransi kesehatan nasional yang didasarkan pada universal coverage. Ini merupakan suatu lompatan besar bagi kami untuk menuju sistem perlindungan kesehatan masyarakat yang lebih baik.